Hi, this is Dr. Laurence at Kidsability. I'm the clinical psychologist in the clinic. What I wanted to talk today about was actually dyslexia. So dyslexia, everybody pretty much knows what it means. It means that a kid struggles to read. What people know less about is that there's actually different types of dyslexia, and these different types of dyslexia need to be identified and treated in different ways. So when a child starts to read, they start to read on grapheme-phoneme correspondence. So they look at the word chair, they break it down, ch, h, air, and then they see it again, ch, h, air, and then the third time's faster, the fourth time they've nailed it, and they can just say chair. So the two parts of the brains that are working are different. So one is the phonological, so the temporal lobe part of the brain that's going to be working for that sound recognition. Once they see the pattern and they can say it really fast, that's how they become fluent readers. And that's the visual part of the brain. So it's a very different part of the brain. So when a kid has what's called dyslexia, we need to understand, is it phonological, so that sound part of the brain? Is it orthographical, so the visual part of the brain where we quickly can see the patterns? Or is it a mix between the two? So there are different types of dyslexia, the phonological, the orthographical, the combined, and then there's something else called rapid naming. Sometimes people say that's the foundation of dyslexia, and sometimes they call it like its own separate dyslexia. So some kids actually are okay in the phonological, orthographical, but then they go and read a passage and they really struggle. And it's because they struggle with rapid naming, so the rapid execution of the words. And so these are all different types of dyslexia, and as you can tell from that, understanding which type a child has is important as to the therapy, because when it's sound, you're going to be doing a different therapy than when it's visual, and if it's combined, again, a different therapy. And that is why it's so important, again, to do an assessment, to do it properly, to do it thoroughly, and to understand exactly what lies underneath, because each brain is different. And that's why when you look at different kids with dyslexia, they can all look different, and sometimes, teachers say, well, but this kid presents this way, but this one doesn't, so they can't have dyslexia. But yes, they can. It might just be a different type.